Dr. Reilly, you have invited youth ministers to understand that they have a uniquely fruitful and generative role to play in the mental health care of their children that are in their groups because of their presence in a nurturing community and over a long time and their ability to observe and attend to the internal dynamics of the kids. But I think that when we invite youth ministers to take care of and be responsible for attending to these issues, most of us are going to think, I'm not trained to diagnose. I'm not trained to intervene. I'm not trained to prescribe. I'm not trained to care for. I'm getting a little overwhelmed by the invitation to participate in this. Help us understand how you see the role of youth ministers and the limits of the waterfront of what they should be expected to do.
Absolutely, and I do acknowledge that it feels like a scary topic. It certainly is a very serious topic, but I think it's important to know that there are so many ways to be able to be supportive, but not responsible for treatment. And in fact, I'm inviting the youth ministers to be able to hold a safe space for the kids, but by no means should they feel like they have to do risk assessments or conduct therapy or determine what kind of services would be more appropriate for children. Indeed, that is something that mental health practitioners can help with. And so in essence, what we're asking the youth ministers to do are to be careful observants, to be able to understand and interpret behavior from a mental health perspective, but a mental health and wellness perspective too. So they're not just thinking about how do I look for illness and how do I diagnose it, but what can I do in my daily interactions to promote the emotional and the spiritual well-being of kids.